Welcome back everyone to the series of videos we're doing at the Wellbeing Centre. Today we have Yulia.
Hi.
And Yulia is going to explain a little bit more about what she does at Theo. So, Yulia, what do you do at Theo Wellbeing Centre?
Hi everyone, I am Yulia, I'm an osteopath, but I'm also a Pilates and yoga instructor, and I specialize in rehabilitation. And I work a lot with people pre and post-operatively, as well as a general sort of looking after their bodies in terms of exercise prescription for very specific purposes, sports orientated or anything else, like you want to fix a little niggle that hurts you over there all the time, and I can figure it out and help you to solve it. But of course I offer hands-on treatment as well, and among other things I also specialize in working with lymphological disorders and doing lymphedema related treatments.
Wow, so you do a lot.
Yes, quite a bit.
You do a lot. One thing that sticks out is the pain detective.
Yes.
Can you explain a little bit more about what that is and how you can help someone that maybe has a pain but you need to dig a bit deeper?
So this is the very interesting way of looking at the body compared to a general sort of approach in terms of treatment. So I'm just going to give you an example rather than going in a lot of descriptions. So let's say you have a bit of a pain, and let's say it's your shoulder is hurting, but it's not really a huge problem, but it occurs all the time. So let's say every 2-3 months you do something that is a very normal movement, I don't know, pick up a cup of tea or something like that, and your shoulder just have a little niggle, a little tweak, and you go, oh, it hurts again, and then it lingers on for a couple of days, maybe a week, maybe 2 weeks, and then it settles again, and you keep having these issues. It could be an ankle, it could be a knee, it could be your lower back. And you go and have it massaged or see a physio or an osteopath, and you have a little work done and it gets better. But then it happens again and it happens again. And no one can really say or answer your question, why is this happening? What am I doing wrong? And this is where the pain detective comes in. So what I do is specialize in looking globally at the whole body, from head to toes and from toes to head. And I look at the functionality of your body. So it's not just statically looking, let's say, oh, we have a little bit of here and there, something is not quite symmetrical, which is, to be fair, most of us are. But it is mainly looking at how your body translates the movement and how it reacts to movement. And what happens that most of us adapt for our lives in very specific ways, which creates very specific patterns of movement that we are completely unaware consciously, but we replicate them because as we move in daily patterns, doing anything, including new movements, and your body will just decide to do things the way it's used to, not because it's not doing what it meant to be doing, etc. It's just because that's your normal. Your body is used to doing it that way. That's the least powerful resistance, even though it's not the most efficient and optimal way of doing things, but it makes it, after a while, for your body to compensate in other ways, creating a little bit of more tension points, creating a little bit more restriction, and after a while it starts to accumulate, build, and leads to these niggles and pains. And obviously it could be a really big thing as well as little things, like I mentioned. And this is what I have to say I'm quite good at.
Absolutely. No, all therapists at Theo Wellbeing Centre are amazing at what they do, so it's just lovely to meet someone that is proud of that as well. So that's fab. So what I'm hearing then is these niggles, these pains that maybe are constant, or maybe that is what you dig deeper into finding out. I'm thinking of things for me now, but we're going about
good. And the way I approach it as well is a little bit different, and I can offer different ways of approaching it to a person depending how they prepare to work or what they have time for, because we have busy lives, isn't it? So it could be a combination of treatment and exercise prescription, and that could be catered to their abilities, availability, time, etc. of the individual person.
Fab.
And the goals as well. It would be different with someone who just wants to be able to go for a walk and have no niggles versus someone who wants to do a marathon run.
Absolutely.
Yeah.
So you tailor it to the person.
Exactly.
And what sort of person would want to book onto you? What sort of pains, problems? What does that person look like?
Anybody. Literally anybody.
Yeah.
I don't have any preference in terms of
anyone you can help.
Anyone who needs help,
Yeah.
really. I do work with a lot of people who are a little bit more mature,
Yeah.
because they tend to have a little bit more problems, and often, unfortunately, they just don't get enough care because it left us, well, getting older, we have aches and pains, and it's not necessarily the case.
Yeah.
With a lot of problems that they can be managed, and I do work with 70, 80-year-old patients who benefit greatly and improve greatly, and it enables them to do things that they love, like sing in the choir or go for long walks with the dog.
And ripple effects of the treatment.
Exactly, just having a normal, full, joyful life rather than being restricted by pain. So I would love to see more people from the village who have a few, or beyond the village. But also at any age. I work with children as well, not very young though, so age 12 upwards. I work with a lot of dancers, gymnasts, anyone doing racket sports, golfers, pretty much anyone, really.
Fabulous. So you're willing to help anyone that needs it.
Yes.
That's brilliant to hear. We've spoken a little bit off camera as well about the importance of movement. Can you fill us in with your wisdom on that?
Well, as you can